All right, let's dive into something pretty interesting today, huh? A deep dive that might just completely change how you think about drug laws.
Oh, yeah.
We're going to be talking about legalization, decriminalization, and regulation of drugs,
Right.
and all that with the help of some pretty insightful YouTube videos that you guys have sent to us. So get ready for personal stories, expert opinions, scientific data, and even a global case study or two. So are you ready to find out if the way we approach drugs is really the most effective way?
It's a question that's been around for decades.
Hmm.
You know, policymakers, researchers, individuals, everybody's been thinking about this.
Yeah.
And it's more relevant now than ever.
Yeah, absolutely. So let's jump right in with a video that really throws down the gauntlet. The War on Drugs debunked the inconsistencies of drug law from the Rationality Rules YouTube channel. This one goes straight into the heart of the matter, questioning whether a drug's legal status actually lines up with its potential for harm.
Yeah, and right away, things get interesting. This video mentions a 2010 study by David Nutt and the Independent Scientific Committee on Drugs. What they did is they ranked drugs based on their potential harm.
Oh, wow.
And they didn't just look at addiction, but a broader impact, including physical damage, societal costs, even the impact on the economy.
Okay.
So the whole 9 yards.
So it's like a holistic kind of a look at the harm.
Yeah.
Okay. And what did they find?
Well, the results were pretty shocking. Alcohol, which most of us consider a pretty normal part of life, was ranked higher on the harm scale than heroin and crack cocaine.
Wow. That is shocking.
Yeah, it really is.
Yeah.
And on the other hand, substances like LSD, ecstasy, and mushrooms, which are often painted as super dangerous, were found to have a much lower risk profile.
Wow. So, like, if you were to base drug laws simply on the harm, that a drug could cause,
Right.
It seems like our laws are completely upside down.
It really makes you think, right? Why are some substances legal, despite their high harm potential, while others with a lower risk profile are criminalized?
Absolutely. Okay, so before we get too deep into policies, let's take a step back and consider the human side of all of this. We're talking about people's lives here. You also sent us this video from BBC Three called Drugs Laws. Should Britain Legalize Drugs? This one takes a look at the personal side of the drug debate.
Yeah, this one really brings home the human cost of drug abuse.
Yeah.
Especially the story of the mother who lost her child to heroin addiction. Just a raw reminder of the devastation that addiction can bring, not only to individuals, but to their families, to the community.
Yeah, it's easy to get caught up in the arguments and the data and the statistics, but we are talking about real lives, real people.
Right.
And it affects their families, their friends.
Absolutely.
But the video also makes this point that most people who use drugs don't actually become addicted.
Right.
Which kind of goes against what a lot of people think. So, maybe we need to move beyond these simple categorizations of user and non-user.
Yeah, because it's really a complex issue.
Right. So that brings us to the discussion of alternative approaches. And the War on Drugs debunked video brings up this fascinating case study. Portugal.
In 2001, Portugal did something pretty radical. They decriminalized all drugs.
Wow.
And that meant shifting their approach from a criminal justice model to a public health model.
So instead of focusing on punishment, they basically said, hey, this is a health issue.
Exactly.
Okay, so what kind of impact did that have?
Well, Portugal actually saw a big decrease in drug-related deaths.
Yeah.
And HIV infections.
Really?
Yeah, they focus on harm reduction. They provide treatment and support services to those in need rather than just throwing people in jail.
Okay, so it sounds like Portugal might be onto something there.
It's definitely worth looking into.
All right, so let's talk about regulating drugs like we do with alcohol. Could that actually work for harder substances like cocaine or heroin? The VCE video, the reality of legalizing cocaine, heroin, and ecstasy, the war on drugs, kind of goes into this very controversial idea.
Right, and they use the examples of alcohol and tobacco to explain how a regulated market could possibly work.
Okay.
I mean, think about it. We have age restrictions, quality control measures. We even have limits on advertising for those substances.
Right.
Could we apply a similar framework to other drugs?
It's a really interesting idea, but I imagine there are some concerns about increasing drug use if things are more easily available.
Of course, and the video acknowledges those concerns,
Yeah.
but it also emphasizes that we need strict controls, like limiting how much people can buy and having responsible marketing campaigns to minimize those risks.
So it's like we're acknowledging that these substances exist and people are going to use them regardless of legality, but we're trying to manage it.
Exactly.
Okay. The VCE video also goes into this very interesting approach. The Swiss model of heroin-assisted therapy.
Now, this one might raise some eyebrows. Basically, Switzerland gives medical-grade heroin to users under strict medical supervision.
Wow.
It sounds counterintuitive, but the goal is to help them stabilize their lives, reduce crime, and give them a pathway to recovery.
Okay, so is it effective?
It's actually been pretty successful. Switzerland has seen a significant decrease in crime and overdose deaths among participants.
Wow.
And it connects them with the support services, which is critical in addressing those underlying issues that often lead to drug abuse in the first place.
That makes sense. So let's talk about a figure who's been pretty outspoken about drug decriminalization, Carl Hart. He's a neuroscientist featured in the Vice News video, Meet the Neuroscientist Who Wants to Decriminalize Drugs. And his perspective is pretty interesting.
Yeah, Hart believes that adults have this fundamental right to alter their consciousness, as long as they're not hurting anybody else. He's really challenging what we consider to be acceptable behavior and advocating for personal freedom when it comes to drug use.
He's not afraid to push the boundaries, is he?
No, he's not. He's using his research on heroin and his belief in responsible drug use to back up his arguments.
It's definitely a thought-provoking stance that's bound to cause some debate. Now let's move on to the legal maze surrounding marijuana in the U.S.
Right.
The Bloomberg Law video, How Marijuana is Both Legal and Illegal in the U.S., kind of breaks down this whole issue.
It's a pretty confusing situation, to be honest. Marijuana is legal for recreational use in a lot of states, but it's still classified as a Schedule I drug at the federal level.
So it's like it's legal and illegal at the same time.
Yeah, it creates a ton of challenges for businesses and individuals in the cannabis industry.
I bet. I mean, imagine running a business where the federal government considers your product illegal. That's tricky.
Yeah, the video really highlights the issues with banking, taxes, and even just running a business. They face a lot of challenges because of this kind of legal gray area.
Wow. So even though marijuana is becoming more and more accepted, there are still huge hurdles to overcome. Now let's talk about a substance that's been making headlines for all the wrong reasons. Fentanyl. The infographic show video, Every Illegal Drug Explained in 15 Minutes, offers a pretty sobering look at this powerful opioid.
Yeah, it's a major issue. The rise in fentanyl-related deaths is alarming. It's so potent, and it's often laced into other drugs. Even a tiny amount can be lethal. It's considered the deadliest drug in the world.
Wow. So why is it so much more dangerous?
Well, the video explains that it's mostly because of its potency and because it's added to other drugs without people knowing.
Oh, wow. That's terrifying.
It's a huge contributor to the opioid crisis.
That's a really scary thought. Is there anything that can be done?
Well, there is a treatment, naloxone, also known as Narcan. It's a life-saving treatment for opioid overdoses.
Oh, okay.
Increasing access to naloxone and educating people on how to use it is crucial.
Wow, so we've covered a lot of ground already in this deep dive. Everything from inconsistencies in drug laws to the human stories behind them, and then the need for new approaches.
Yeah, and we even talked about decriminalization, a regulated market, and even that Swiss model of heroin-assisted therapy.
Right. Plus the legal maze surrounding marijuana in the U.S. and the dangers of fentanyl. It's a lot to process, but we're just getting started.
There's a lot more to uncover as we explore this really complex and evolving issue.
Definitely. Stay tuned for part 2, where we dig even deeper into alternative approaches, their successes, their challenges, and the ethical stuff that comes with changing how we think about drug policies.
It's going to be good. Welcome back. You ready to keep going with us?
Oh, yeah, I'm ready. After that last segment, I'm super curious about this whole regulation thing. The VIC video, The Reality of Legalizing Cocaine, Heroin, and Ecstasy, the War on Drugs, made a pretty compelling case for it, but I'm still trying to figure out, what would a regulated market actually look like? Like for cocaine, for example.
Yeah, it's a huge idea. We're talking about a complete change to the system.
Yeah.
Imagine instead of back alley deals, people could go to like a government dispensary or even a pharmacy to buy regulated doses of cocaine or MDMA.
Oh, wow. So it'd be like a state-run system to ensure quality and safety and all that. It's pretty radical.
It is radical, yeah.
But I guess I can see how that could cut down on the dangers of the black market.
Exactly. That's the whole point. Plus, the money made from those sales could then be used to fund drug treatment programs and prevention.
Oh, that's a good point. So it kind of tackles the issue from both sides.
Exactly. A public health approach.
But I'm sure some people would be worried that if drugs are easier to get, more people would use them.
Yeah, that's a common concern.
Yeah.
And the video did talk about that. They highlighted that you would have to have strict regulations, kind of like we do with alcohol.
Yeah.
Age restrictions, limits on how much you could buy at once, and responsible marketing campaigns.
Oh, okay. So it's kind of like we're acknowledging that these substances exist. People are going to use them no matter what. So let's try to manage it.
Exactly.
Yeah.
And it would also open up research opportunities. Like right now, it's hard to study the potential medical benefits of some of these substances because they're illegal.
Oh, right. Yeah, that makes sense. So regulation could open up all these doors for science.
Exactly.
But let's talk about people who are already struggling with addiction. How do we help them transition to a healthier life?
Well, the Swiss model, remember we talked about that in the VCE video, heroin-assisted therapy. It's a pretty unique approach. Some might even say controversial.
Yeah, I'll admit, when I first heard about giving medical grade heroin to people under supervision, I was like, really? How does that work? But the video showed how effective it is at reducing crime and overdoses.
It's all about harm reduction. By providing a safe environment, Switzerland has seen a big drop in the negative stuff that usually comes with heroin use.
And I read somewhere that there's been like no overdose deaths in drug consumption rooms anywhere in the world.
Yeah, it's amazing. And it allows people to, stabilize their lives and get access to services they need to recover.
So it's more about meeting people where they are and helping them instead of punishing them.
Exactly.
It sounds like a much more compassionate approach. Speaking of compassion, let's go back to marijuana. I mean, it's getting legal in more and more places, but that Bloomberg Law video, how marijuana is both legal and illegal in the U.S., it really pointed out the confusing laws, especially in the U.S.
It's a mess, to be honest. You've got states where it's legal for recreational and medical use, but then the federal government still says it's illegal.
So you can be breaking the law and following the law at the same time.
Pretty much, yeah. It's a nightmare for businesses.
I can only imagine. They must have trouble with everything, like banking, taxes, just the basics of running a business.
Exactly. It's like they're stuck in this weird gray area, and it really holds the industry back.
It doesn't seem fair, especially when you think about how the war on drugs has really hurt communities of color. And now with all this legal confusion, it seems like those injustices are continuing.
That's right. Drug policy isn't just about individual choices. It's about society as a whole. We need to think about how these policies affect different communities and try to make things more just and fair.
Absolutely. And wouldn't you say that education and harm reduction are key to making that happen?
Totally. That VCE video we talked about earlier, they showed the work of organizations like The Loop in the UK.
Right.
They do drug testing at festivals and give harm reduction advice. Help people make safer choices.
So instead of just saying, don't do drugs, we can actually give people accurate information and help them reduce the risks.
Exactly. It's about meeting people where they are.
The video also had that story about the mom who lost her daughter to an ecstasy overdose. That was so sad. It really showed how important accurate information and harm reduction are.
It's tragic. It shows that we need to move past these scare tactics and just be real with people.
I think we also need to think about the root causes of drug use, like poverty, mental health, lack of opportunity. Those are big factors that contribute to addiction.
Absolutely. We can't just ignore those things. Addiction is often a symptom of something deeper going on.
Yeah.
We need to build a society where people have support and opportunities.
So in this part, we've talked about regulation, harm reduction, and the importance of education and compassion.
Yeah.
And just being more understanding about drug policy.
Yeah, it's been a good discussion. We've seen how questioning the status quo and being open to new ideas can really make a difference. It can reduce harm and create a better environment for everyone.
For sure. But we're not done yet.
Nope. Stay tuned for the final part where we'll wrap up everything and leave you with some things to think about as we all try to figure out this whole drug policy thing.
Welcome back to our deep dive into drug policy. It feels like we've covered so much already, from the inconsistencies of drug laws to all these alternative approaches like decriminalization, regulation, even heroin-assisted therapy. We talked about the challenges with marijuana legalization here in the U.S. I mean, it's a lot to unpack.
Yeah, it really is. And it's been a journey, challenging some pretty deep-seated beliefs and exploring all these different perspectives.
I think for me, what's really stood out is just how complicated this whole thing is. There isn't just one easy answer, to solve all the problems around drug use.
You're absolutely right. And it's different for every place, right? Every country, every community, they need to look at their own situation, their culture, their specific challenges when they're trying to figure out drug policies.
But with all that complexity, I keep coming back to this one big question, like, what's the main goal here? What are we trying to achieve with drug policy? Are we trying to reduce harm or just punish people? Is it about moral values or is it about public health?
Yeah, that's the million-dollar question. And if you look at the videos we've been talking about, you can see how that traditional war on drugs approach,
Yeah.
the one that's all about criminalization and punishment, it's had a lot of unintended consequences.
Yeah. That Rationality Rules video, the war on drugs debunked, the inconsistencies of drug law really made me think. Our current laws, they seem to be based more on fear and stigma than actual science and understanding the harm.
Right. Remember that study we talked about by David Nutt? Alcohol, which is legal, was ranked higher for harm than heroin and crack cocaine. It really makes you wonder.
Totally. And then you've got Portugal, which did something really bold. They decriminalized everything and went with a public health approach.
And they're actually seeing some good results. Fewer drug-related deaths, fewer HIV infections. They're helping people instead of locking them up.
Makes you wonder if other places could do the same, right? But even if you're focused on harm reduction, there's still so much to think about. Like, could we ever actually regulate something like cocaine or heroin?
Things get really tricky there. That Vice video, the reality of legalizing cocaine, heroin, and ecstasy, the war on drugs, they went deep into that.
I thought it was really interesting how they compared it to alcohol and tobacco. We regulate those things, right? We try to control access, make sure the products are safe, reduce the risks. So could we do that with other drugs?
It's an idea, but it's a big one. And yeah, people are going to worry that more people would use them if it was legal. But the video pointed out that it could actually weaken the black market, bring in tax money for treatment and prevention, even lead to more research.
So it seems like we need to weigh the potential benefits against the risks.
And put in safeguards.
Yeah.
Right, so that things don't get out of control. But even if we do all that, there's a whole other level to think about. The ethical side of things.
Of course, some people are going to say, hey, if you legalize it, you're saying it's okay. And there's the risk of more addiction. And then there's the question of whether the government should be involved in all of this at all.
Right.
It's not easy, that's for sure. And we can't forget about individual choices. Carl Hart, the neuroscientist from that Vice News video, meet the neuroscientist who wants to decriminalize drugs. He really got me thinking about personal liberty and the right to make your own decisions about your own body.
He's not afraid to shake things up. It's a really important debate, right? How much control should the government have over our personal choices? What's the balance between freedom and keeping people safe?
Yeah, and we have to respect individual choices, but at the same time, we have to be aware of the potential consequences, right?
Yeah.
Both for the person and for everyone around them.
Absolutely. And that's where things like harm reduction come in. Like those guys at the Loop, they're not saying don't do drugs. They're saying, hey, here's some information, here's some resources, here's how to stay safe.
I keep thinking about that mom from the video who lost her daughter. It just shows you how important it is to have good information and help available.
It's a tragedy. And it shows that we need to be more compassionate, more pragmatic. We need to create a space where people can get help without being judged or punished.
So after this deep dive, I think the biggest takeaway for me is that there's no easy fix for this. It's messy, it's complicated, but if we stay open-minded, listen to the science, and try to understand each other, I think we can start to make things better.
I agree. We need to keep learning, keep having these conversations, and push for policies that actually make a difference. Policies that are about harm reduction, public health, and taking care of each other.
That's what it's all about. Thanks for joining us on this deep dive. We hope you found it insightful, maybe even a little challenging. Keep thinking about these issues, keep talking about them. We all need to be part of the solution.